There's been a spike in influenza cases, with many people requiring hospitalization. The National Institute for Communicable Diseases says this was first noticed in August. Influenza cases have been identified in 5 provinces. To discuss this more, NICD senior epidemiologist Dr. Sibongile Walaza joins me now from Johannesburg. Doctor, thank you so much for joining me this evening. So you're reporting there's a spike in cluster influenza outbreaks in schools and workplaces. It's a bit odd, isn't it? Because it's summertime right now. Why is this happening?
Yes, I think, as you rightfully say, so that it is odd. Normally, with South Africa, we normally have our influenza season during the winter months. And this is now just before we had COVID-19. However, now we've not had we've had very little influenza circulation during this period. But then from our surveillance programs, we've noticed that there's an increase in influenza cases from August. And it could be a number of reasons, I think, but one of the main reasons that we think is the most important one is the relaxation of the prevention measures that were put in place for COVID-19. And of course, because it has not circulated for more than 18 months, so it is possible that there is also an immunity gap in that we've got quite a number of people who are susceptible to influenza.
And is this something to worry about? Are we seeing, is it more mild symptoms, or are we seeing a lot of hospitalization?
So because we've had reports from different places, but from our surveillance program, it's in hospitalized cases and also in outpatients. However, it is, as you know, with influenza, it is possible that, some people will have it as mild and they present with mild symptoms and they get better. However, we do have groups that are at risk of having severe disease. But at the moment, we're still not sure how severe it is. But I would still like to recommend that those who are at risk of having severe influenza and having influenza complications should seek medical help as soon as possible.
When you say those who are at risk of severe influenza, who are you speaking about here?
So, okay. We've got, different people are at increased risk. So people who've got underlying conditions, like people who've got diabetes or who've got chronic lung disease, or who are immunocompromised, like people living with HIV or who've got cancer, and also the extremes of age. So the elderly and children who are very young, like less than 2 years. So those are at increased risk of having severe disease and requiring hospitalization if they do get influenza.
So we've got the pandemic, the COVID-19 pandemic currently at the present moment. Unfortunately, one might start feeling flu-ish and so forth. What are the similarities, and how do I differentiate? How do I know maybe I must actually go for a COVID test, or this is just a common flu?
So, most of the symptoms are actually quite similar. And at the moment, the only way, to make the difference is if a laboratory test were to be done. But, if that's why we're saying that people who present, if they have respiratory infection, they've got a fever and a cough and generalized body pains, and some will progress to having pneumonias, then those people should be seeking care. But in terms of differentiating between the two, it is quite difficult. The definitive way to do that is to do a laboratory test, and that can tell you whether you've got the influenza or you've got COVID.
And there are different strains, aren't there?
Yes, there are different strains of influenza. Normally, we'd have about a co-circulation of influenza strains circulating. So we've got influenza A, influenza A H1N1, which was the strain that first circulated in 2009. And then we've got H3N2, and we've got influenza B viruses. And these can really co-circulate, during a period of influenza, when the influenza is circulation. And it's difficult to say upfront what is going to be predominant. But from the cases that we're seeing now, we've seen a combination. We've got some influenza Bs and H1N1 and influenza H3N2. However, the one that has been most predominant for at least that we see in South Africa is influenza B Victoria.
So, is the vaccine is still the best way, maybe, to maybe negate this, getting the flu in the first place?
So, right, yes. So vaccine is the best form of prevention to protect yourself against influenza. But also important to understand that normally, only before we had COVID, we'd say people should go for influenza vaccine before the influenza season. But now we're seeing influenza in the summer months. But we're still saying that for those individuals who are at increased risk of influenza, severe influenza illness, if they've not received the influenza vaccine, they should still go and get the vaccine. But not forgetting the fact that, we've seen that since COVID, there was very little influenza that was circulating, and people presenting with influenza, and that was purely because people, used masks and they washed their hands, they practiced social distancing. So those things are still really important, for people to do if they want to protect themselves from getting the influenza.
And the flu vaccine, is it for all ages?
So it is for individuals who are older than 6 months, and however, this is still, I understand that the government clinics still have them, but still prioritizing those who are at increased risk, as I've mentioned earlier. But it's licensed for individuals who are older than 6 months.
Okay, thank you so much, Doctor, for speaking with us this evening. So the NICD reporting a spike in influenza cases and outbreaks at schools and at workplaces. So the best